your time today. My first question is, over the last 2 years, we have seen considerable progress being made in the field of ovarian cancer, be it treatment, be it survivorship, be it research advancements. With the explosion of PARP inhibitors in ovarian cancer treatment, what, in your opinion, is the future vision of treatment as well as research in terms of developing newer agents and more personalized treatment options for ovarian cancer?
It's a very exciting time right now for new treatments being developed. So both anti-angiogenesis drugs that target the blood supply to cancer and also the PARP inhibitors have fairly rapidly developed. Now there are 3 PARP inhibitors that are FDA approved already. I think one of the new areas is that while these drugs are important for improving patient outcomes, unfortunately most patients still develop resistance to these drugs over time. So we and others are working on understanding how cancers adapt to these drugs and then trying to develop new combination therapies that could even be more effective. And they're very exciting areas with these 2 drugs that are being developed.
So tell us a little more about what is exciting in this field, because we, as as a nonprofit and also the survivor community we serve, we all want to know what's happening in this field.
So with the PARP inhibitors specifically, there are clinical trials done here as a part of our Moonshot program and other work as well, where Dr. Mills, Dr. Weston, Dr. Coleman have looked at samples pre and post treatment and looked at how at a molecular level these cancers are adapting, and then that's identified some new combination opportunities, and already those are well into clinical development at this point. Now we don't obviously know whether these will be superior and whether these will prolong or improve outcomes even further, but that's what these trials are designed to address.
And so what is the current state of research in early detection, testing, and identification of high-risk individuals for ovarian cancer, and what improvements do you foresee in the near future?
I think one of the areas that we've learned a lot about is that genetic testing is very important for women who are diagnosed with ovarian or even certain types of breast cancer as well. We very much recommend that women who are diagnosed with high-grade serous, endometrioid subtypes, or even some of the other subtypes of ovarian cancer, that genetic counseling and testing be performed, because that helps to identify 2 things. One is that can be of benefit to other family members, and then moreover now the PARP inhibitors, as you alluded to earlier, are FDA approved, and so that can open up other avenues for treatment as well. With regard to early detection, there's a lot of work, no doubt, being done, but it's a bit more challenging of an area where there are markers that are being tested, and CA-125 and ultrasound, those have certainly been used, but they haven't been as effective for widespread, for community-wide testing at this point. But regardless, there's certainly a lot of other work being done to develop better and newer markers.
So I'm just curious because I have family history, and so for someone, and I did my BRCA testing, I came out negative. So given the fact that I have family history, but I am BRCA, my gene testing came negative. So for people like us, what is our future path? What are we supposed to do in terms of surveillance, in terms of just staying on top of the symptoms and other things?
In the absence of a genetic link, we recommend obviously working with your physician or with a gynecologist for regular checkups, but we don't recommend necessarily screening types of surveillance, because that hasn't been proven to be effective in such settings. Now, if someone who has a family history of BRCA positive ovarian cancer, and that individual tests positive, then in that setting we will increase the amount of surveillance.
Okay, and I also think that for people like us that don't test positive but have a family history, you don't really recommend a hysterectomy or, taking anything out or just keeping surveillance on, right?
With a single family member being affected, no.
Okay.
Now, there are certain families where there might be several family members affected, but yet the genetic screen is negative.
Mm-hmm.
That may simply mean that we haven't discovered some of the other genes that may play a role. In that setting, again, it has to be a fairly careful discussion with the physician to figure out whether prophylactic approaches should be considered.
And I think that's important to know, because what Dr. Sood just mentioned is if you have more than one family member that's impacted by ovarian cancer, then you should have a discussion with your physician in terms of what your options are. But if you have only one family member that's impacted by ovarian cancer, then the need for reduction in like risk reduction treatments is probably not as needed as for the other scenarios. My next question is, tell us about the knowledge that has emerged through research in terms of DNA damage and repair, changes in ovarian cancer cells and tumor microenvironment, and how is this knowledge being applied to more effectively control ovarian cancer?
Those are fairly broad areas of research. So for DNA damage, there are certain abnormalities at a molecular level that can occur in these cancers. And it turns out that those cancers that have defects in DNA damage repair, these are the cancers that tend to be more susceptible to PARP inhibitors. And so there are now assays that have been developed to test for such abnormalities. And with regard to microenvironment, there's just enormous work being done, both to develop drugs against the blood supply to cancer, but also to understand why ovarian cancer is not quite the same as certain other cancers with regard to the immune system. Mm-hmm. And it tends to lack penetration by some of the immune cells, and as a result, ovarian cancer doesn't perhaps respond as well to immune therapies mm-hmm. as certain other types of tumors like melanoma and so mm-hmm. on. But that's not to say that immune therapies aren't important. It's more that work in the microenvironment, meaning the surrounding tissues around the cancer, is going to be really critical to understand to improve these kinds of immune therapies.
Mm-hmm. And what is your opinion on molecular profiling to guide treatment options and decisions, as well as clinical trials for patients? And is this something patients and families should consider during a treatment process? What would you recommend?
That genetic testing or this kind of testing occurs in many different forms. So the testing for the BRCA1 and BRCA2 genes, that we recommend on a regular mm-hmm. basis for everyone. And that's what we call germline testing, where we're testing the blood sample itself mm-hmm. For those kinds of changes. Now, molecular testing, where the changes perhaps exist only at the level of the tumor, frequently we'll do that especially in patients who have relapsed cancer mm-hmm. to try to identify or match with specific types of molecular therapies or clinical trials. Mm-hmm. But it's still a relatively early field, and the number of such matches currently is around 10 to 15%. But as this whole field evolves, we expect that will become a bigger proportion.
So then for these 10 to 15%, what is the benefit of doing this profiling? I mean, what happens to a patient when she is matched by her profiling to a particular clinical trial or to treatment options? Tell us a little more about that.
Well, it opens up avenues for certain therapies mm-hmm. That may be targeted at those kinds of molecular defects. Now, whether or not that truly translates into clinical benefit mm-hmm. for those patients, we don't know yet, but that's our hope, and that's a reason to do these kinds of clinical trials.
So the objective like a curing the disease, or with this type of profiling, or is the objective for a longer survival for the patients? What are we trying to accomplish by doing this?
Ultimately, we obviously all want to aim for cure, but
Definitely.
in the near term, though, that's not an easy thing to accomplish for a cancer like this, in part because vast majority of patients present with advanced stage disease.
Mm-hmm.
So in the near term, if we can achieve longer survival, there's obviously value in that.
Mm-hmm. Okay. And then, my final question is, you have done a lot of research on the impact of stress,
Mm-hmm.
diet, lifestyle options that may alter the risk of ovarian cancer. So tell our audience a little more about the impact of stress and other things that you have seen, how it might impact patients and, enhance their quality of life.
Sure. It's a very interesting area of research, and stress, the way, is a catch-all term. So we really look at when we're talking about chronic stress and acute stress, by the way, or short-term day-to-day stressors, that's not something that's really that bad in the context of cancer. Mm-hmm. That's very adaptive, and that is actually a very normal or adaptive effect. But chronic stress, and some examples are caretakers of chronically ill people, mm-hmm. or even to a certain degree we would consider changes related to major depression, mm-hmm.
Mm-hmm.
Perhaps fall into that category, may affect how patients do, and so in that setting it's important to engage professionals who can help those individuals. Again, whether or not interventions are effective, mm-hmm. we don't fully know yet, but that obviously is an area that really needs to be looked at further.
So in terms of, I'm just going to dive a little deeper in terms of the stress. So in terms of cancer patients, stress is a huge factor, mm-hmm. right? So what, in your opinion, could be some ways they could manage stress, or how does it really impact the cancer, the advancement of the cancer, so that our viewers know about mm-hmm. that? And is there anything that they should be watching out for in terms of stress management and things of that nature that might impact their disease?
Mm-hmm. We're really trying to design tools whereby all patients can be screened for stress factors. There is data that chronic stress may influence the trajectory or the outcomes of patients with cancer, and that the opposite is also true, that social support is an important buffer. Mm-hmm. Social support meaning the extent of network that an individual has around them, and that tends to be related to better survival mm-hmm. outcomes. With regard to, again, in terms of modifying, there are a lot of different possible options, but whether working with the physician directly or engaging psychologists mm-hmm. as well, mm-hmm. That's really where interventions can be considered.
Effective. Okay. And my final question to you is, this is September is Ovarian Cancer Awareness Month, so we are working very hard to get the message out on ovarian cancer, to encourage people to talk about ovarian cancer, because this is a silent disease, but we don't need to be silent about it. We need to be vocal about this disease so that more people get to know, and they're on top of symptoms, and so they get detected early. And so we all know that in the absence of a screening test, awareness is our best bet at this point. So stay on top of your symptoms. And so as we close out on the Ovarian Cancer Awareness Month, what would be your message to our audience in terms of awareness, in terms of detection, in terms of survivorship, treatment, anything that you would like to share?
As far as symptoms go, in the past people used to think that women who present with especially early stage cancer, that they don't have symptoms, and that's not true. They do have symptoms, so things such as pelvic pain or pressure, mm-hmm. Bloating sensation, nausea. What's different is that the symptoms tend to be persistent, mm-hmm. And they tend to be more frequent as well. So if someone is having those kinds of symptoms, they should really engage with their physician. And
so is there a timeline to which they should wait and then go to a physician to present with their symptoms?
If the symptoms are persisting really more for a month or more, they really should engage with someone and have them look into it.
Okay.
If they resolve completely and never recur, obviously some of these symptoms can overlap with other benign conditions, and that's the challenge at times.
So your message, coming back to the audience, your message would be to stay on top of symptoms, to encourage everyone to continue to talk about ovarian cancer to your friends, to your family members, to your network, because in the absence of a test, as we have both discussed, awareness is the best. And so with that, we thank you so very much for your time.